Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I would like to present our job related to community service, addictions counseling to reduce smoking addictions in university student. We are Lilim, Halimah, Suci Nugraha, and Suhana from Faculty Psychology of Universitas Islam Bandung. It is presented in Bandung Annual International Conference, September 5th, 2023. Okay, as the introductions, smoking among university students is often seen as something that can help relieve boredom. But this activity actually can have negative effect on health, especially with high usage and addictions. There are divergent opinions regarding the legality of smoking among Muslims. Some of them said that smoking is haram, and some of others said smoking is makruh. Bandung Islamic University, or UNISBA, as a higher educational institution, implements a campus-wide no-smoking policy as a preventive measure against smoking addictions among students. Many smoking students want to quit actually, especially those who have experienced health problems, but do not know how to quit or lack support from family and friends, that making it difficult to quit smoking. The methods of community service itself is in response to issue at hand. The community service team organize addictions counseling to decrease the inclinations towards smoking and smoking addictions, particularly among students. The addictions counseling employs the technique of motivational interview with the stages of engaging, focusing, evoking, and planning. The counseling begins with the client intake, conducting a pretest to assess the level of smoking addictions. Subsequently, the formulations of the case or behavioral dynamic of addictions is created. A diagram is illustrating the dynamic of addictions is developed using the biopsychosocial model and the 4 P's, while describing the predisposing, precipitating, perpetuating, and protecting factors of addictions from the biological, psychological, and social aspects identified from the clients. The counseling sessions are provided to 8 students as the clients, with each client attending 5 sessions or 5 meetings. A post-test is administered during the 5th meeting to measure the level of addictions. The counseling is conducted using the drugs framework. The drugs framework is utilized a tool to aid in the screening and interventions process for substance addictions. It serves a practical method for counselors to maintain non-judgmental communications during the screening process. This model emphasizes the importance of therapeutic relationships for the success of treatment. Within this framework, counselors assess the components of D, R, and U. This approach is the most practical way to establish a framework for conversations during the screening and initial interventions process. This activity is related to 2 institutions, namely the students of UNISBA and the Faculty of Psychology at Bandung Islamic University. The Faculty of Psychology at Bandung Islamic University plays a role as a speaker providing counseling to students who are addicted to smoking. The UNISBA students who are addicted to smoking, in this case, represents the institutions in the community. This activity also provides benefits for UNISBA, namely, first, as a means of practicing of the 3 Dharma of higher education, namely community service. Second, as an effort to maintain the existing partnership as a caring entity in empowering human resources in the community. And the third, the benefits that can be obtained by smoking addicted students at UNISBA from this activity are freedom from smoking addictions. The results of this activity, the counseling is conducted in a 12 weeks program. The results of the counseling shows a significant change in the intensity and quantity of smoking. We can see from the table, client 1 to 8, symptoms addictions before interventions, the client 1, 10 symptoms, and after intervention becoming a 7 symptoms. Client 2, 10 symptoms becoming 7. Client 3, 10 symptoms becoming 8. Client 4, 10 symptoms becoming 9. And client 5, from 8 symptoms reduce become 5 symptoms. Client 6, from 8 symptoms to be 4 symptoms. Client 7, from 9 symptoms to be 7 symptoms. And finally, the client 8, from 10 symptoms to be 6 symptoms. So, conclusions, the provisions of addictions counseling proves effective in diminishing the symptoms of addictions among UNISBA students who are addicted to smoking. Within a short period of time, these students experience reductions in addiction symptoms. This aligns with various research findings that quitting addictions is not an easy task and requires a lengthy process. This process is indeed a challenging journey for individuals struggling with addictions. They necessitate long-term interventions to prevent relapse. That's all our presentation. Wassalamualaikum warahmatullahi wabarakatuh.